Morning.
Good morning.
Yeah, today we're going to have a class. It's about TCM, traditional Chinese medicine. Today I'm going to show you some Chinese ways how we Chinese doctors to diagnose about the symptoms, like based on symptoms. Then based on the tongue inspection, I'll tell you whether he or she is sick or not. So looking at the tongue, it's actually basic. We have two basic ways. The first way, it's called tongue inspection. The second way is pulse, palpitation. It's like 3 fingers like this. So before that, do you have any question about this? Daniel, you go.
I think.
Can you speak louder?
I think
I hear you.
I would say that the tongue, the Asian tongue, the African tongue, and the
It's different. Even though you're black, your skin is black. My skin is yellow, white people, but the tongue is almost the same. Do you understand? Almost the same. The same question actually I want to ask, guys, Yeah, like a blood is also red. Do you understand me? So the look is same, look the same. Yeah, look at this. First one, we have a look at the picture. Yes, look. So you guys see, there's 2 pictures here, right? 2 pictures. Can you tell me, just basically for your first instinct, tell me, which one's good, what's bad? Your first instinct. Zhang first.
Yeah,
This
the
one
right
good.
one, yeah.
This is good.
Yeah.
This one.
Yeah.
Good.
Yeah.
What's your assumption? Why do you think this one tongue is normal? This is the abnormal. Why?
The right one looks so pale.
Looks so pale. Okay, Daniel, you?
I think that the left one looks normal. The right one has cracks on it.
Cracks, some cracks like this. All right, Mr. Ho.
Well, I think the left one is right. It's in good condition, but
Good condition. You see, I pay attention to where you say good condition. What do you mean a good condition?
I mean, like by the appearance of the surface, it does shows how like that is a bit different from the right one, since it has like cracks.
Oh, cracks. So I'm gonna say congratulations to all of you guys. Your first instinct is right. This one's normal. But then today, I'm gonna show you how to exactly to do inspection of the tongue as a doctor, as a professional doctor, because I said there's 2 basic ways, approaches for Chinese doctor for diagnosis before. We don't have used any other devices, ultrasound, we don't use MRT, or don't use some kind of very advanced technical stuff to do this, detect it. But we use a very traditional way. But just like about 5,000 years ago, or 200 years ago, before Western medicine come to China, so what we do? So based on pulse taking and then, tongue inspection, that's it. Look, so what we see the first one, the tip. We'll look at the tip. The tip, it's in charge of heart and lung. Got it? And sides, the margin. This one is called liver, gallbladder. Both, yeah. Most both sides. Then this side, it's a kidney. And this, in the middle, is a spleen and stomach. If you see a patient, if you see a person, you see the tip of the tongue, it's pretty red, it's reddish. You can 100% that. You must have an insomnia last night. You maybe have some problem, urination problem. You say, oh, really? You say, surprised, you say, how do you know that? Because it's a heart alarm, because the heart is in charge of your sleeping in Chinese medicine. This is a miracle. Later, I will teach you step by step, okay?
Okay.
Any ideas?
That's
good. Okay, move on next. All right, let's move to see the picture here. So, Danny, you go first. So, tell me which one you think is good. Left, middle, right.
I think I would go for the middle. I'll go for the middle one.
This one.
Yeah.
Okay.
Go for the left one.
Left one. You gonna say the right one?
I mean, like, I think the middle one.
Middle one.
Yeah.
But actually truth. So, you're right. This is normal. You should be pale red. Pale red. Not too red. Not too pale. And lustrous. Okay. So this means qi and blood is sufficient. This one is a little pale. Then it means a qi and blood deficiency. This one, definitely, no one choose that one as normal because you see that the blue and purple, right? What does it indicate? If you look at some old person, old people, when they come here for help, you say, Mr. Frank, doctor, I want to help. Show me a tongue. They say, oh, just, you will be shocked by some tongue looking. Why? It's totally blue and purple. What's wrong? It usually means stagnation of a qi and blood. Do you understand stagnation? Because circulation of blood and qi is not going smoothly. There might be tumor, cancer, all right? Now, we're based on the body fluids and tongue characteristics. So tell me which one's normal?
The left one.
Yeah, you're right. Definitely the left one. Because that's too dry, you see? It means he or she may have a diarrhea. Or she may have a fever last night. Now, this is what you guys may be quite interested about. Why? Because the special features of a tongue, it's very useful evidence for you for diagnosis. See, number one, first one, fissure in tongue, just like a crack. Number two, spotted tongue. Third, teeth printed. Yeah, what's mean? Is the crack of this, like a fissuring of tongue. So yeah, many patients, they're gonna, in the middle of the night, they feel very dry. They have to wake up the second day, in the middle of the night, to drink one whole bottle, then he can sleep well. Then look at this one. You see, this is like, see, spotted. What happened? It is usually indicating some inner fire inside, inner fire. Maybe he had arguments with somebody else. Maybe he had a bad mood. Maybe yesterday he ate too much spicy food. Anyway, there must be something with the inner heart, inner side, fire. If somebody have a teeth printed tongue, usually have a digestive problem. He feel uncomfortable, or the stool is very watery and probably a little loosening. Now, he or she might always feel tired, exhausted, pretty much, because this one, teeth printed tongue indicating spleen deficiency. In Chinese medicine, spleen is the most important because spleen is the organ which is in charge of the whole digestive system. It's not like a Western medical, we say the spleen is different. It's different way. So it means a spleen deficiency. So look at your tongue yourself, whether you have it. So if you have like that tongue, then you should drink some Chinese medicine to help you to get better. If you're weak, you have a lower energy. Some people are very energetic. You look very, like, wow, crap, like, what happened? Look at tongue. That can explain everything. So look at this one. Tell me, which is normal?
Oh, the right one is normal.
Definitely right. Why?
Yeah.
Why?
Yes.
First, tell.
Because the left one seems so
So what?
white. It has
White? You mean the color of body is white?
Yeah,
What?
it seems like has something like fiction, something like that.
Then you?
It has white. It's white coated.
Why is it not good? Why is it?
Because
think-
the blood and chin, it's in the right one, it's good.
Right.
Pale red, the color. Pale red color. It's the first thing I'm talking about. That's the first priority for we look in the town, right? The color. But now we're gonna teach you something new. Look, we call tongue coating. Just like this is a tongue body, something there like this. Something like this. Tongue coating. First one, look at the tongue body. Second, look at the tongue coating. Understand me? What tongue coating like? Look. This is the thick, too thick. Not good. Thin tongue coating. Normally, we should have a thin tongue coating, means your body in good condition. If you see somebody have a very thick tongue coating, it must be some problem. This is 100%. Clear? You see, what's problem? I'll explain it later. It's very complicated. I will explain this later. This is the thin, this is the thick. So, but if somebody have zero tongue coating, it's a good? I'll tell you the truth, it's gonna die.
Yeah.
Like a mirror.
Yeah.
Just like a glass. No matter Western medicine or Chinese medicine, no one can save you. This is the way for you for diagnosis for somebody dying or living. Clear now? Yeah. If you see somebody at the very beginning, they have a very thick, then later it's just gone over one night, usually indicating, overnight you're dead. This is dry tongue coating. Dry. That one is too slippery tongue coating. Too slippery. Too slippery tongue coating usually indicating there's something yang deficiency. If somebody have a yang deficiency, he or she may have a problem. They are very low energy and feel easy tired. They feel very extremely cold in the winter days. Even like in the hot summer day, the hands are cold, being cold always. But what about this one? Yellow and tongue coating, you see, right? Yellow tongue coating, it usually infers some heat inside. You see here, this side is no tongue coating, right? What happened? There means sometimes it's going to terrible. It's like a map. Like a map. A map. Here it means in the body there's the two things are fighting. You know what fighting? The evilness and our inner chi is fighting. Understand me? Evil chi is invading us, the fighting inside.